third lecture series of live webinar organized by Jain Institute of Nursing and Research, VISM Group of the Studies, Gwalior. I, Professor Jayashree Ajit, welcome you all to join us within this webinar. Today, we are hosting the third live webinar on the topic Effect of Yoga in Pregnancy. The aim of webinar is to share the information regarding the benefits and importance of yoga. As we know, pregnancy is a precious gift of God to women. During pregnancy, she has a lot of changes in her physical health and mental health, which makes mother more stressful and anxious. There are different contemporary theories to overcome from stress during pregnancy, but yoga not only reduces the stress and anxiety, but also makes mother feel calm and good. It supports the body and mind, which will have a good impact over the health of the fetus. Today, we are organizing webinar on the effect of yoga in pregnancy. It's my pleasure, immense pleasure, that we have this eminent speaker with us and our chairman, sir. I extend my heartfelt welcome to Dr. Sunil Kumar Singh Rathore, sir, Honorable Chairman, VISM Group of Studies. He's very dynamic and enthusiastic, especially in academics. Sir, your support and encouragement help us to reach in the heights. I request, sir, to express your blessed views to the participants.
सबसे पहले आज के इस वेबिनार में आयरलैंड से प्रोफेसर अपर्णा शुक्ला जी को मैं बहुत बहुत धन्यवाद दूंगा कि आज वो हमारे वेब सीरीज में एज ए मैन स्पीकर बन के आई हैं। और इस वेब सीरीज को ऑर्गेनाइज करने के लिए ग्रुप डायरेक्टर डॉक्टर प्रज्ञा सिंह जी, डीन प्रोफेसर जयश्री जी, प्रिंसिपल नर्सिंग प्रोफेसर अक्षय बेस्ट, रिसर्च कोऑर्डिनेटर प्रोफेसर बंसल और सभी टीम को मैं धन्यवाद दूंगा कि इस कोरोना काल में भी एक अलग तरह से हटके, कभी हम लोग VISM ग्रुप के ऑडिटोरियम में बैठ के बात किया करते थे। आज अगर अपर्णा जी हमारे ऑडिटोरियम में होती तो उनका बुके से मैं स्वागत करता, लेकिन आज मैं दिल से उनका स्वागत करता हूँ VISM ग्रुप ग्वालियर मध्य प्रदेश में कि आज वो हमारे बीच में है। और आज का जो टॉपिक है रियली बहुत ही अच्छा टॉपिक है, योगा का प्रेगनेंसी में क्या किस तरह से किया जाए। आज बहुत से डॉक्टर्स देखने से डरते हैं, वो प्रेग्नेंट महिलाएं जो सफर कर रही हैं, वास्तव में जिनको रियल में डॉक्टर्स चाहिए उनको डॉक्टर्स नहीं मिल पा रहे हैं। योगा एक ऐसी चीज है जो हमें कहीं न कहीं हमारे मानसिक तनाव को दूर करती है और एक कॉन्फिडेंस डेवलप करती है। आज जितने भी पार्टिसिपेंट्स हैं VISM ग्रुप के जय इंस्टीट्यूट ऑफ नर्सिंग रिसर्च में जुड़े हुए हैं, मैं इससे पहले भी अपर्णा जी से बात कर रहा था, तो अपर्णा जी नो डाउट मुझे बहुत अच्छा लगता है जब कोई ऐसे बोलता है कि नर्सिंग को इंडिपेंडेंट काम करने के लिए मिलता है, उस आइलैंड धरती में इस तरह से काम करने को मिलता है कि आप 9 महीने तक लोगों को एडवाइस करते हैं। ऐसी एडवाइस इंडिया के मिडवाइफ को भी मिलना चाहिए, क्योंकि बहुत बड़ी आबादी है। इस आबादी में केवल डॉक्टर के भरोसे को छोड़ना या प्रेग्नेंट को कहीं न कहीं एक बेईमानी सी दिखती है। हम जब सब मिलके साथ साथ चलेंगे को भी उतना ही रिस्पेक्ट मिलेगा। हाँ, कॉम्प्लिकेशंस हैं आप डॉक्टर्स के पास है, लेकिन उनको एक मेंटल सपोर्ट देने के लिए या उनके जिस तरह की प्रॉब्लम्स आती है उनको सॉर्ट आउट करने के लिए अगर यहाँ पे टेलीफोनिक मिडवाइफरी जैसा स्टार्ट हो जाए तो रियली इंडिया में भी नर्सेस को रिस्पेक्ट मिलेगा और एक बहुत बड़ी पॉपुलेशन को एक सपोर्ट मिलेगा। आज के हमारी मुख्य वक्ता को VISM परिवार की तरफ से बहुत बहुत उनका स्वागत करता हूँ, वंदन करता हूँ कि भविष्य में भी हमसे जुड़े रहें। आज हमारे जितने पार्टिसिपेंट्स हैं उनको कुछ हटके ऐसा बताए जो वो पब्लिक को बता सके, कह सके कि आयरलैंड में भी नर्सेस का अच्छा स्कोप है, रिस्पेक्ट है और वो भी समाज की कुछ कर सकते हैं और योगा की क्या इंपॉर्टेंस है वो लोगों को बताएं। VISM के परिवार से इस तरफ से उसका बहुत बहुत धन्यवाद।
I'm very thankful to sir for motivating words. I welcome the eminent speaker, Madam Aparna Shukla. She is working as a telephonic midwife advisor in Ireland. She has completed her master's from RK College of Nursing, New Delhi in 2004. She has completed professional course in therapeutic Use of Mindfulness from Institute of Integrative Counseling and Psychotherapy in 2015. Madam has completed Mindfulness Stress course in 2017. She has completed her course on enhancing clinical practice from University College, Dublin, Ireland. Now she is working as a Yoga Alliance certified yoga teacher, and also she's her owner, the Sub Connections also. So it's my immense pleasure, ma'am. I request you to Madam Aparna to share your views and experience, share the views and experience to the audience.
Thank you, ma'am. Thank you so much, Professor Jayashree Ajit and Dr. Sunil Rathore and Institute of Nursing and Research for giving me this pleasure to address the audience. And I'm absolutely delighted. And first of all, आप सभी को मेरा प्यार भरा नमस्कार आयरलैंड से. अभी यहाँ पर सुबह के 6:35 हुए हैं. So it's really early morning here, and I know that India is 4.5 hours ahead. But we are going to start this topic in a different way because the theme is different. And thankfully that we have started to look a little bit away from just corona-related topic. So I really congratulate, first of all, this institute for selecting such a good theme because life exists beyond corona. Corona is not here to stay for too long. So we must continue to look on the most important regular healthcare business that we are in. So I want to invite you all to take a moment and connect with your breath with the sound of the bell. Take a deep breath in through your nose and out through your nose. Now bring your right hand on your belly and left hand on your heart and connect to the breath and see how it feels in the body. Thank you. So this was just to help you to connect with the breath and realize that if you put your hand on your belly, that your abdomen rises and falls with each breath. And behind this belly, there is a uterus. And in that uterus, there is little life that is created, which is absolute miracle each time that happens. And I can tell you that I'm so always surprised, like when I used to work in a maternity hospital, in one of the Europe's busiest maternity hospital, I can say, we had birth of about 8,500 babies per year. So every time I was working in labor ward, every birth always gave that sense of a little miracle being created. So pregnancy and yoga. Let's look at the meaning of yoga. So as we all know that yoga comes from Sanskrit word yuj. Yuj meaning union. Union of body, mind, and soul. And this union is perfectly in manifestation when there is a life inside a woman's body. So when woman is creating this little life, then she is in union with this fetus. And she's connected through her yogic body. So whether she does yoga or she doesn't do yoga, but each one of us have this yogic body. It is up to us whether we want to access it or not. So when we talk about, I always base all my teachings on yogic body model whenever I teach yoga. So in yogic body model, there is the outer layer, there are 5 sheaths. So we believe that body, everybody's body, like it's nobody's different. Everybody's body is made up of these 5 different layers. And the outermost layer is most dense and the innermost layer is most subtle. So the outermost layer is called Annamaya Kosha. So see the meaning. Anna means food. Maya means illusion. Kosha means sheath or the layer. So Annamaya Kosha or food body. How is that important in pregnancy? Because Annamaya Kosha, if mother is not nourishing her food body, how the baby is going to get that nourishment? So it is what mother eat, and the little kind of, the juices of that food go to the fetus and nourish their body. And researches have been done, even like what mother was eating when baby was in the womb, and how they made their food choices as an adult. So it is so important for a pregnant woman to nourish her Annamaya Kosha or food body. Then the second layer of the yogic body is called Pranamaya Kosha. Prana means life force energy. Maya means illusion. Kosha means sheath. So how pregnant woman is breathing, that is what brings oxygen to her unborn baby. So when the baby is growing in the uterus, it is important that pregnant woman is breathing properly, consciously, in full awareness, and taking a full breath. And in Ireland, we always include breathing exercises as part of their antenatal education. So every woman who goes here in labor always learn how to breathe in labor. So when they get contractions, they have already been trained how to deal or manage with contractions through the breath. And breathing is not something that just happens on a lungs basis, but when we breathe, we engage our sympathetic and parasympathetic nervous system. And it is very clear to us as a health professional that when we breathe, then there is this oxygen that goes into every single cell of the body. And we know that until 10 weeks, placenta does not work. So placenta is there, but it is still developing. And it's only after 10 weeks of pregnancy that placenta becomes fully functional and starts to pass on the oxygen to the fetus through placenta. But all that time, and even after that time, it is important that how pregnant woman is engaged with her pranamaya kosha. Then we come to the third yogic model, body layer, which is called manomaya kosha. Manomaya kosha is thinking body. So how uska man kaisa hai? Pregnant woman जब जिस समय वो अपने बेबी को अपनी बॉडी में नरिश कर रही है, then how, what she's thinking, what's going on in her head, what is she thinking? It's so important because sometimes pregnant woman is not saying a lot, but she's thinking a lot. And what is she thinking? That's what I'm interested in. And that's why I have actually designed a course which is called Mindful Mamas and Papas. So I want to train women to think properly, because that is what is going to create a healthy baby. Because it's part of the preventive medicine. All our doctors have been working really hard in the area of preventive medicine. So the first stage of preventive medicine is called primal prevention. Primal prevention is related to the health or the thoughts and the stress level of the mother when the fetus is in her body. That means the fetal environment, what kind of environment mother is in and what kind of thought she's creating, that decides what kind of this little baba or little baby is going to be as an adult. It is so important. So it's already kind of personality is almost decided when the baby is in the womb. There have been a lot of researches done in this area that if a mother was in very hostile, aggressive environment, or if she was very sad, depressed, unhappy, then this may have effect on this child when this child grows up and may not ever know that why he's feeling, why the way he's feeling. So it is very important that we take time as a healthcare professional, as nurses, midwives, doctors. We always talk to women and tell them the importance of reducing stress, creating right thoughts, because a lot of people don't even know that they create thoughts. They just think that thoughts just come from somewhere. They don't come from somewhere, you create them. So that's what mindfulness is about. So thinking is what we are. You know, I must have thought one day that I want to become midwife, and that's why I'm a midwife. I must have thought one day that I want to become a yoga teacher, and that's why I went on and did the training and became a yoga teacher. So we are what we think. And in the same way, we want pregnant women to be really happy and joyful and peaceful when she's making the baby, because she's doing the job of the creator. When the God can't be here in this world the whole time, he sent mother and he said, I am giving you some of my responsibility to create human life. So it's no ordinary job. When you are pregnant, you are making this world go. And there is a very famous quote, which I think I have it written somewhere from Khalil Gibran. If I can find it, I would love to share with you all. Let me see if So Khalil Gibran said once, your children are not your children. They are the sons and daughters of life's longing for itself. They come through you, but not from you. And though they are with you, yet they not belong to you. So every child that you are creating, they have much bigger purpose to serve in this world, much beyond that they are your sons and daughters. They are a responsible citizen of this society. So it is the responsibility of the parents who are creating these babies in the womb and then making them as a responsible adult. This is what kind of society we are creating. And there have been a lot of researches that what kind of environment when the babies grew up, and what kind of career they took off, or they became a criminal because they were raised in such type of environment. So it is so important that we teach women the importance of manomaya kosha. जैसा अन्न वैसा मन. So इसका मतलब ये है कि अन्नमय कोशा and manomaya kosha is also linked. Some of my friends in Ireland would be listening to this. So just to translate in English, that jaisa anna vaisa man means the type of food that we eat, that type of thoughts we carry. And that's why in ancient Indian culture, there have been a lot of importance has been given on vegetarianism, eating vegetarian food. And even in vegetarian, some people decide not to eat pyaj, lesun, means not to eating onion and garlic, because they believe that it's a tamasic food and it makes your thoughts very hyper. So Annamaya kosha, manomaya kosha, very much linked to each other. And then also the conscious awareness of what you are thinking. That also helps to create peaceful thoughts. Then the fourth layer of yogic body, how it is important for pregnant women. So Vijnanamaya kosha. Vijnanamaya kosha is called wisdom body. So wisdom body means a woman who has worked on herself and she's consciously nourishing the baby, is actually quite wise, and she's wisely making decision for her birth. So just to give you a little example how she can make use of her Vijnanamaya kosha. So in Ireland, women prepare, like, I can proudly say that in my job as a telephonic midwife advisor, where I work, there are majority of my clients, even if they have never ever practiced yoga before, they start to practice it for the first time when they become pregnant. And it's called prenatal yoga, and they all join for prenatal yoga. So about 80 to 90% of my clients practice yoga in pregnancy. And I'm so proud to say that. And also they go for a lot of gentle birthing courses where they learn to connect with the breath and how to remain calm during labor, and they learn different poses that they can practice, and then they write birth plan. So they write what they want in terms of their birthing process, because they play their role as an active partner in their maternity care. They don't just go and sit there that, oh yeah, you decide as a midwife or a doctor, and that is good because we empower these women to make those decisions. So that means pregnant women use Vijnanamaya kosha to make wise decisions about their birth. And it is extremely important for us as a healthcare professional, as a doctors, nurses, midwives, that we always support them in making those decisions for their birth. Then coming to the last or the innermost, the most subtle layer of this yogic body model. And that yogic body model is called Anandamaya Kosha. Ananda means bliss. Maya means, even we say Ananda is also an illusion. So don't get too attached to Ananda either. And Kosha is sheath. So Anandamaya Kosha or bliss body. So when we say bliss body, means that is the ultimate goal of yoga, is to reach and activate your bliss body. And for a pregnant woman, imagine if she even got a glimpse of her bliss body, if she got a glimpse of her Anandamaya Kosha, if she started to live in Ananda. Ananda means a joyful state. And what is the difference between happiness and joy, you may say? That how they are two different things. Yes, they are very different. So happiness depends on a reason to be happy. So she may say that I'm happy because my pregnancy is going really well and everybody in house is treating me really well. My husband is very good to me. He's looking after me. So she's always dependent on other people to keep her happy. But a woman who has activated her Anandamaya Kosha will be joyful regardless of what is going on in her outer world. So she will be happy just because she's alive and she's making and creating another life. So we want pregnant women to understand this, because it is not in her control how people around her will behave. What the doctor will say to her, she has no control. What her husband will say to her, she has no control. What her sasuma or her mother-in-law will say to her, she has no control. Like a lot of women are just unhappy because there is some, gharelu jhagda, and there is unrest in the house, and then she creates these unrestful thoughts and she becomes very unhappy. But we want her to see from a bigger perspective, from higher perspective, that it's that she's doing such a bigger job. She shouldn't be really concentrating on small, trivial things. And she should be joyful regardless. So that was my full yogic body model, which I think is really important for pregnant women and to understand. And us as a childbirth, like I'm also a qualified childbirth educator. So I educate women on how to remain calm during birth. And I've also trained midwives on how to educate women for antenatal education. So I'm going to now, in a couple of minutes, share my slides, and then we will look at all these things more scientifically and from the point of view of a nurse teacher, midwife teachers, and midwives practitioners. So everybody knows, especially in India, where yoga actually originated. So yoga belongs to world, but it has a home, which is in India. So we are so proud that Patanjali, the father of yoga, who actually did not invent yoga. Yoga was always there, as far as we know from our Vedic Upanishad and Vedas. They all contain information about yoga. And yoga was always about the mind. It was not about the body. So it was always suggesting to use the body as a tool to create that stillness in the mind, to purify the thinking process of the mind. And that's the main thing of yoga. So we must remember, and especially in India, we must teach women yoga. And if some of you who are nursing teachers or nurses or midwives working in maternity hospitals, you can go and train as a yoga teacher like I did. And then you can start teaching yoga in the maternity hospital. And it will be, that's what we do. Like here, a lot of midwives are teaching yoga in maternity hospital. So women are going to midwives to learn yoga. It's such a perfect, beautiful combination, because we come in this profession because we want to serve, and yoga gives us another tool to serve humanity, to serve mankind. So I'm going to start to present my slides, and my big salute to our father of yoga, Patanjali, and his, even one of his Patanjali Yoga Sutra, the second sutra, says Yogas Chitta Vritti Nirodha. Yoga is the stilling of the thought waves in the mind. So even in the second sutra itself, Patanjali emphasizes the importance of stilling the mind. Chitta and vritti is the thought waves. Chitta is that, that antakarana, that means our inner environment. So the inner well-being comes from the practice of yoga. So I'm going to now share my slides. Just bear with me. I may need a little thumbs up from somebody to know that if you can see my slides, or if somebody can unmute and come on and give me I hope everybody can see my slides. Okay, so unless I hear otherwise, I believe that you are watching my slides. So here I am, Aparna Shukla, owner of Shub Connections, and I'm a midwife advisor in my job, and I'm a qualified childbirth educator, Yoga Alliance certified yoga teacher, and mindfulness teacher. I bring it all together in this session. So as we said, that pregnancy is a perfect yoga. It's a union of a man and a woman. They come together to create this beautiful life. And this beautiful life remains inside the uterus, and the connection of the cord through mother's placenta and uterus. And that's like, it whether she calls it or not, it's a yoga, because yoga means union, and she is in this union with her partner and with this unborn baby. So objective of today's session is that after today's session, you'll be able to recognize the physiological changes in pregnancy, reiterate the benefits of yoga and pranayama for pregnancy, and apply this knowledge in teaching breathing exercises or pranayama, and identify your role as a midwife in promoting prenatal yoga. So I don't want all of you to just listen and forget about this session, but please start to promote prenatal yoga. If you see pregnant women in your home, in your hospital, in your nursing college, just encourage them to practice yoga, because it's going to be so good for everyone, because the baby she's making is not only her baby, it's that child who is going to be an adult and a very responsible person of this society. So we all have a role to play to mind pregnant women. And you will be able to demonstrate yogic breathing. I will give you a very short demo in the end, what yogic breathing means. So safe motherhood and primal prevention, these are the two main themes of this talk. The foundation for safe motherhood is laid in pre-pregnancy health. So here, a lot of women, about 50% of women plan their pregnancy. They decide that they want to now have a baby. So they could be on contraceptive pills. And I'm sure it is almost similar in India, that when they decide to have a child, then they come off those pills and they already start to do a lot of healthy eating. They start to take folic acid. And in Ireland, the sun is not that much, so we also encourage them to take vitamin D throughout the pregnancy and until 6 weeks post-birth at least, or until she's breastfeeding. So pre-pregnancy health, and also emphasis on proper nutrition, because it is important that women nurture their bodies through homemade fresh food and a healthy lifestyle. So when we talk about healthy lifestyle, that includes the exercises. That means it's almost must. So in my job, when I do registration for client for the pregnancy, I always ask them that, do you do some exercise? What kind of exercise you do? Like, it doesn't matter even if she's not practicing yoga, but if she's doing walking, swimming, or some type of low impact sports. And walking and swimming are another very good form of exercises for pregnant women. Pilates is another one. So Pilates is quite popular in Western world. I'm not sure in India. I think there are some Pilates studio, but it's not as common as yoga. So these are the different form of exercises that pregnant women can take and must take and should take throughout pregnancy. And some women use pregnancy as an excuse to kind of harbor laziness. But opposed to that, it's a time to actually really become alert and really become active, because active bodies make healthy babies. And continue with appropriate prenatal care. So prenatal care is our importance, and it is the type of care she's getting in a hospital, whether she's going as a private client or if she's going for just public care, she should really get a good, high standard, safe maternity care. And that's her right, and she should not be denied that right by any country. The prevention of complications is another one. So when she's attending her prenatal clinic, we need to be vigilant, and every opportunity of antenatal appointment should be used to tell women what to watch out for. What are the alarming signs? So like in my job, I always tell them that if there is any vaginal bleeding, if there is any abdominal pain, you need to contact the maternity hospital straight away, because these are the two signs that we don't want. But then as the pregnancy progresses, and if she's in third trimester, then we always also advise them about that if there is no, if you're not happy with your baby's movements, so if fetal movements are not good, or if she is thinking that she's leaking some fluid, so it could be amniotic fluid. If vaginal discharge is colored, that means she need to contact the maternity hospital. So this information should be shared in each antenatal appointment, what she need to look out for that particular stage of pregnancy. And then our maternity care continues with effective treatment of any complications that may develop. So if pregnant woman has developed preeclampsia or gestational hypertension or gestational diabetes, or if she is very obese. So maternal obesity is a great concern, because that is that can cause a lot of complications, and majority of the time obese women end up with cesarean because of various reasons. So maternal obesity is a concern, but at the same time, I want to make this message very clear that yoga is for all type of bodies, all type of skin colors. Yoga does not discriminate. And that is not an excuse that, oh, my body is not fit. Like if you are obese, you have every more reason to practice yoga. So everybody can practice yoga, no matter what shape and size the body is, and it will still benefit, and even more so. And nature is so kind that what I have seen and what I have read in researches, that women who are already obese or have lot of, like if they are overweight, then they don't gain as much weight in pregnancy. So if a normal, like not normal, everybody's normal, but if in a woman who has a healthy body mass index, so if her BMI is between 19 and 25, which is called normal BMI or standard BMI, so if her BMI is that, then she may gain about 13 kilograms in her pregnancy. But if she's already overweight or obese, then she may only gain 6 kilo in pregnancy and still make a healthy baby, which is great. So it means nature has already understood that this woman does not need that extra fat deposition around the uterus, that means around the belly and in the breast, because these are the two main contributors as well for weight gain during pregnancy. So overweight and obese women don't gain as much weight, which is great information, and you should share them. You should share this information with them. So there are 3 periods in women's life which are totally ruled by the hormones. So first period, when she is very young, she's at the tender age of 13, 14, and it's called menarche. That means her period start. First time her body kind of starts to prepare to carry a baby. But think about it. When this young girl was in her mother's uterus, that time her own uterus was made. That means, uterus was always there when she was in her mother's womb. And now that her body is preparing to become a mother. So that's the first stage in woman's life, when lot of changes take place in the body, menarche. Then the second hormonal stage in women's life is pregnancy. And because it is something that just happens, we take it very lightly. But we must understand that pregnant women also go through the same hormonal upheaval as women in menopause and menarche. So it is important that we look after them. We understand their psyche, their mental state, and why they are so moody, and we do not fight with them or give out to them for being so demanding, because maybe she's a lovely woman, but it's just that because of pregnancy, she has no control on her emotions. And then the third stage in woman's life is menopause, when she stops making babies. That means her body has done this job or is not going to be able to make the babies. So these three stages in every woman's life are extremely kind of beautiful and challenging. So benefits of practicing yoga in pregnancy. On a physical level, it prepares the body for birth, it alleviates any discomfort, and it prevents wear and tear, reduces back pain. So I remember learning yoga from as a yoga teacher training in my yoga teacher training with Ramakrishna Mission in Ireland. My guru called Swami Purnananda. So he always told me that the best benefit of yoga is for spinal health. So spinal health is what yoga addresses most, and that's what makes yoga different from all the other exercises. Whether you are running, you are weightlifting, whether you are going to gym, but no other form of exercise focuses as much on the spine as yoga does, because yoga is all about back bending, forward bending, twisting, spinal twists. So we really focus on the spine health. And you know that pregnant women really suffer with back pain because the center of gravity moves. It is normally located near the pelvis, around the belly button. But as the belly starts to grow and grow, the center of gravity shifts, and back muscles take a lot of strain from carrying this big belly around. And that's where yoga comes in. So it helps to reduce the back pain. Then the second benefit is on a mental level. So when pregnant women are doing breathing exercises, they are balancing the energy in the body. There are chakras in the body that are located in different locations. So once we balance the energy of the body on the left side and the right side, we do pranayama. So pranayama is not simply breathing exercise. Again, I learned from my guru that prana is the cosmic energy. Prana is the life force energy. And prana is the energy that even moves the breath. So when it moves mother's breath, then this goes into baby. And it is such a profound experience if a woman is breathing in conscious awareness. And then relaxation. So any woman who's practicing breathing exercises and doing yoga, she's bound to feel more relaxed, more calm. And meditation is kind of must for pregnant women so that they can manage their moodiness, they can manage their emotions. And there are a lot of other general benefits of practicing yoga, which is mental equilibrium, letting go of fear of childbirth, and acceptance of natural changes, reduce distress and anxiety, and it empowers women. So in my own yoga teacher training, I did two different type of training. So one, as I said, was with my guru in Ramakrishna Mission in Ireland. Then the other one that I did here is with Durga Yoga Studio. And my teacher's name is Paula Mitten. And with her, I learned vinyasa. Vinyasa is yoga that is very dynamic. So body is kind of constantly moving in a flow, and it is so beautiful to practice in vinyasa. It doesn't matter which form of yoga it is, but as long as your instructor is a qualified yoga instructor and she has some experience of dealing with pregnant women, because actually Paula Mitten also teaches pregnancy yoga. Like she teaches, she prepares teachers to teach pregnant women. So effect of pregnancy on musculoskeletal system. So relaxin hormone affects joints and ligaments, And we all know that the name suggests relaxin, and that's exactly what it does. So this hormone is released in pregnant women's body, and it relaxes pubic symphysis, sacroiliac joint, hip joints, shoulders, ankle and feet, ligament laxity, and hypermobility, causes pain and altered biomechanics in lower limb. So they always complain of a lot of sciatica pain, pain in the legs, and then back discomfort because the spinal alignment is altered. So what happens to body during pregnancy? There are a lot of endocrinal changes during pregnancy. And some of you listening, if you're not in a healthcare profession, then endocrine glands are the glands in our bodies that release hormones. And they could go through a lot of changes, morphological and functional changes. And also from 10-week onward, when placenta starts to take over, and nourish the fetus, then placenta starts to work like an additional endocrine gland because placenta releases a hormone called HPL. And this HPL hormone makes sure that there is enough nutrition provided to the fetus. Then progesterone maintains pregnancy, but near term, so progesterone is extremely important for maintenance of pregnancy. Some women who have recurrent miscarriages, they are given progesterone hormone to maintain pregnancy from outside. But generally, progesterone hormone is released in the body, which helps to maintain the pregnancy. But when women reach near term, then the progesterone level fall and there is increase in estrogen hormone. And this estrogen hormone remains at a higher level. And then when she goes into labor, then oxytocin hormone plays very important role in bringing on the contractions. And after birth, after all these changes of hormonal cocktail or symphony of orchestra that is played with all these hormones in her body, she is left with stretch marks, varicose veins, flabby stomach, sagging breast after breastfeeding, constipation, hemorrhoids, back pain, stress incontinence. Sometimes she leaks urine when she's laughing or whatever, lack of self-esteem. She doesn't feel beautiful because she feels her body is not the same sometimes. She may get that kind of feeling and she sometimes get into depression. So these things can happen due to all the changes that take place in her body. So the foundation of yoga is balance, and endocrine system releases hormones which regulate mood, metabolism, sexuality, and survival instinct. When all these things are in balance, then she feels good. She's in high vibrational energy and she feels positive. But when this system is in overdrive, she feels very stressed out. And when she is in stress, then it causes a lot of stress hormones, cortisol hormones to come out. And if there is continued stress and continued release of cortisol hormone, then it suppresses her immune system. Actually, in medical science, there have been a lot of researches and they found majority of the illnesses, whether for pregnancy or not for pregnancy, are related to stress. So the person who is under the effect of high level of cortisol will develop many infections and illnesses. And deep relaxations that come from yoga by practicing pranayama, by practicing meditation. It will allow women to relax and it gives mind power. And we must encourage them to have some positive affirmations or sankalpa for during her pregnancy. And yogic breathing or pranavayu or conscious breathing plays very important role. So posture and balance is important. Reconditioning the body through postural alignment, increased awareness of sitting, standing, walking, resting. You will be surprised even if you just pay attention to yourself, that how you are sitting right now, Are you sitting in a balance? Are your 2 feet taking equal amount of weight? Is your back straight at the moment? Are you walking in a balanced manner? So you will see that even we are not maintaining that kind of correct posture. So for pregnant women, it is even more hard. She needs to be reminded to sit tall with her spine straight. And the benefits are that if she's carrying her posture correctly, then she will be less fatigued and she will have a clear mind and a healthy back. So again, yoga is balance. There are some rules, and that's why we should only practice with those who are qualified yoga teachers. Warm up is must, and whatever you do on the left side of the body should be done on the right side of the body. Every bending posture should be followed by a counter stretch. In general, these are the rules. No posture should ever be forced, and more so for pregnant women. We must tell them that not to force yourself to make a perfect pose, because it's not about looking good in that asana. If you are standing in Vrakshasana, as you can see in this picture, the woman is standing in Vrakshasana or tree pose. So it is important that she just feels comfortable and develop that sense of balance that comes by practicing Vrikshasana. And prenatal yoga class is best for pregnant women. And in some maternity hospitals here, it is led by midwife. Then it is ideal because she can have conversation about her maternity care, and also she can practice yoga with her midwife. So if we talk about healthcare system in Ireland, it's called HSE, Health Service Executive. And here they always recommend breathing and self-help techniques for labor. So that's their website, hse.ie. You can have a look afterwards and use it as a resource. So learning the art of relaxation will help you during pregnancy. And a lot of breathing techniques are taught to pregnant women on how to focus and how to remain calm. Because if they remain calm, then they will release their own endorphin. Endorphin is a happy hormone. So you don't need always a medication in labor for pain. It is your own natural painkiller or endorphins that are released from the body. So yoga during pregnancy, there was a research done by Frecce, Jadi et al. On the effects on labor pain and delivery outcomes. And no surprise, they found that practicing yoga during pregnancy had absolutely brilliant outcome for their labor, and they remained very calm during labor. And it was done on primiparous women between the age of 18 and 35 years old, and it was a randomized controlled trial. So breathing exercises are integral part of antenatal education, and we teach women birth breathing and feather breathing. So feather breathing is really like breathing through the nose and breathing out slowly through the mouth. So you count to up to 7 breathing in and count up to 10 breathing out. And then second stage of labor is candle breathing. So when baby is about to come out from the perineum, that it is very important that they do not push with their breathing. They actually do like as if they are blowing birthday cake candles. So candle blow type of breathing is very good in second stage of labor. And then we must talk about pelvic floor health because Kegel exercises are highly recommended. I always teach all my clients how to do Kegel exercises. And in yoga, it's called Moola Bandha. So Moola Bandha is kind of a Kegel exercise. And then mountain pose or Tadasana, if it is done with yoga block, is extremely good for pelvic floor health. Chair pose or Utkatasana is extremely good because you are kind of squatting. And then Veerbhadrasana, which is a power pose, and that helps to strengthen the pelvic floor muscles. And Baddha Konasana, again, you are opening up the hips. The more that area is relaxed and open, the more it allows to strengthen the muscles in the groin area and pelvic area. Then a happy baby pose or Ananda Balasana is extremely good for women. And I would always encourage them to smile and laugh or feel like a baby, bring that type of energy of a baby when practicing this Ananda Balasana. There are some contraindications. So some asanas should not be practiced during pregnancy because they put pressure on the abdomen. We do not want any yoga exercises or any yoga asanas that creates abdominal pressure. So intra-abdominal pressure should not be created by any form of exercise. And actually, on that note, I was only speaking to a client very recently, and she was told by, like, she had developed a little bit of umbilical hernia in the pregnancy, which is okay, like it's not a big deal, and mostly they are harmless. But surprisingly, her physiotherapist suggested her to do Pilates and do some core muscle strengthening. And I was like, and woman was not convinced. She probably knew something is wrong. She's not given right advice. And she was calling me to ask whether she whether I would recommend Pilates. And I was like, Pilates is fine, but if they are core muscle exercise, you can't really do them when you are already having a little bit of umbilical hernia. And plus, we don't recommend them for pregnant women anyway. Like pregnancy Pilates is very different to normal Pilates. So go for a Pilates instructor who knows how to teach pregnant women, but you won't be strengthening your core muscle when you have umbilical hernia. So it is important that the instructor is fully qualified and knows how to deal with pregnant women and their bodies and their conditions. And don't lie on the belly for Bhujangasana, Shalabhasana, or Dhanurasana, because these are the back bends that are done lying on the belly. So after 20 weeks, when she is in that stage of pregnancy, we would never recommend her to lie on her belly. And any poses where she has to lie flat on her back for too long, it's not contraindicated that she can't lie on her back at all. She can, but as long as she doesn't spend too long lying on her back, because that will put pressure on inferior vena cava, and that can kind of compromise the blood supply to the uterus. And that's why we recommend pregnant women to lie on their side rather than lying on their back. And avoid Kapalbhati pranayama. Kapalbhati is very popular since Baba Ramadev introduced it to general population through TV, through so many channels. And I remember even when I had my first baby, that was a long time ago, in 2004. So when I had my son, I used to watch a lot Baba Ramdev, and I used to practice postnatally after birth, a lot of, exercises. And my son learned Kapalbhati, and he couldn't even talk. He was such a small baby. But if I ask him, Arush, how to do Kapalbhati, and he would just show off his tummy and do like, and he was just breathing through the nose and showing me how to do Kapalbhati. So that brings me to the end of my presentation and the services that are offered by Shub Connections online at the moment because of COVID-19. Yoga classes, pregnancy yoga classes, mindfulness and meditation, and mindful mamas and papas. And then I have done a lot of training for Irish nurses and midwives organizations, professional development center. So I have trained midwives on mindfulness and meditation for holistic care. Telephone triage, telenursing. I have been on a national speaker. I have been a speaker in national telephone triage conferences, and pregnancy complications workshop I have facilitated. And I've also facilitated workshops for midwives, how to lead antenatal classes, how to teach postnatal classes and parenting classes. So you can follow Shub Connections on social media. And actually, I would urge all of you, if you have liked my presentation, then please like my Facebook page, which is called Shub Connections, and also follow on YouTube. On every platform, it's called Shub Connections. On Instagram, on Anchor Podcast, and YouTube channel. If you subscribe, I'll be very thankful to you. So these are some of the references, although I have studied lots of books to prepare my presentation. And thank you so much to Professor Jayashree Ajit from JN Nursing Institute and Research and WISM Group of Studies in India, and IT department, because they play such an important role for organizing all this. So all the guys who are working in IT department, my heartfelt thanks to you. And Dr. Dr. Sunil, I think he was there, and all organizers who are involved in this, and all the participants, because without you, there'll be no webinar. So thank you so much, everyone, for joining me. And I will stop sharing, and I just want to show quickly a couple of things before I end my presentation. Yes, I'm back here. So just to clarify that when I was talking about pelvic floor, so see this area, all this area plays the most important role when women are ready to give birth, because baby will be passing through the birth canal like this. So all these muscles need strengthening, and that can only be done if they practice Kegel exercises, if they strengthen all these pelvic floor muscles. And so please encourage all women to practice Kegels, practice Mula Bandha with their yoga practice. Thank you so much. That was one thing that I couldn't show. Namaste.
Thank you, Madam Aparna. Your presentation was very informative and was very motivative, and hope the participants, and especially final year students who are studying in the BSc Nursing 4th years, they will be enlightened all the yoga importance, and they are the future mothers also. So it will be very beneficial for them. Thank you very much. Thank you very much, ma'am. And also, I'm very thankful to the management also, the management of our chairman, sir, Sunil Rathod, sir, and our director, ma'am, and whole VISM group of the family, those who have participated and cooperated us to organize this webinar. Thank you very much. Thank you very much. Thank you.